esophagus goes up, and it kind of goes in there. You see, it goes up, it keeps going, and it's gonna be under the. So you kind of have to expose it a little bit. You know what I'm saying? So this will be the esophagus. It's still part of the gastrointestinal tract, right? It's still part of the digestive system. So what I normally do, because this is the easiest part to tag the esophagus, I put the tag right here, and then the one for the trachea will be right there. But you will know that one of the tags will be for the digestive system in the form of the esophagus, and the other tag will be for the respiratory system in the form of the trachea, right? Okay, guys? So I just wanted you to note that because it's going to be kind of sort of far away from the whole, business over here in the abdominal. All right? So, and then once we've done all that, and then, of course, mesentery. You see the mesentery? When I expose it, it looks like flowers and so forth, And there's, the yellow portal vessels, and which are veins of the of the digestive system here, but they lead all to the liver, and so it's triple tagged, and then of course red is the arteries. Okay, all right. So that's that, and so you see the mesentery. All right. We got our spleen over there, which is right here, and we got our small intestine. We got our large intestine. And we got our pancreas and duodenum and sphincters in the region of the stomach, the lesser and greater omentum. And we got the liver and the lobes. So now we go to the gallbladder, right? The gallbladder just stores bile. You see it? I'm trying to kind of expose it. What we could do, we could try to peel it off of here. You know what I'm saying? You see, I'm trying to peel it off. You know what I'm saying? Peel it off. So, what I want to do is, sometimes you don't get that lucky and you can see the cystic duct, which goes to the gallbladder, and the hepatic duct, which comes from the liver, because bile is produced in the liver. So the bile duct will conduct bile, and then it splits like that from the liver. And it's got the left and right hepatic ducts, because one going to the left side and the other one going to the right side. But it will be hard to see those. But you may see them up here, but it's pretty much divided up here. So usually it's hard to see these ducts, but we'll do our best. So maybe this part here would be the cystic duct, and this part going there with all this connective tissue would be the one coming from the, sometimes called the common hepatic duct, because it is come from the left and right, okay? And then the common bile duct is the one that then, at the common hepatic and the cystic join at the Y, and then continue to the pancreas, where the pancreas ducts open into the duodenum, the common bile ducts. You see it? Do you see it? You see it? You see it right there? If I had somebody to kind of hold this, and then I'll show it to you. Yeah, thank you so much. So you see, this would be the common bile duct, and then this going up to the gallbladder would be the cystic duct, and going up here would be the hepatic duct. We just call it hepatic duct, okay? But like I say, it's sometimes called the common hepatic duct because it will split into the left and right hepatic ducts, okay? And that's that, really. And then you will see how that pancreas is going. It's okay, you're good. How it's coming, you see how the duct is coming in. And where the pancreas opens into the duodenum, that's also where the common bile duct will deposit the bile into the small intestine, into the duodenum. The bile is really to emulsify fat. So if you eat like a burger, McDonald's, and you get lots of fat in your diet, once it enters the duodenum, it will stimulate the release of the bile.
I thought bile was stored in the gallbladder.
Yeah.
It is stored in the gallbladder.
So what happens to it if you don't have a gallbladder then?
Straight piped.
Yeah, it's straight piped from the liver. You see, what happens here is that, when you produce bile, the liver produces bile. Remember when we talked about the functions of the liver, and one of them was to produce bile, remember? So it will come down the common hepatic duct, right? Come down. And then it will probably go down as far as the common bile duct. But the sphincter here is closed. And this is producing, right? And then it starts to go back up into the, gallbladder, and it's stored there. It only comes out here when the sphincter is open, which is when you get fatty diet, or most of your diet contains some fat. So definitely bile will be released because it emulsifies fat into small